A 21-year-old male presented with positional headaches. I am showing you multiple brain MRI slices. Describe the findings.
Let's see. Yes. The selected MRI images demonstrate a well-defined round lesion located in the anterosuperior aspect of the third ventricle. The lesion is mildly hyperintense on the T1 weighted images, while demonstrating variable signal intensity on T2 weighted sequences. A graduated fluid level is visible within the cyst, suggesting proteinaceous or mucinous content of varying density. There is mild dilatation of the lateral ventricles, indicating early obstructive hydrocephalus.
I am showing you an unenhanced axial brain CT scan. What does it demonstrate?
The unenhanced axial brain CT demonstrates a well-defined hyperdense round lesion at the level of the third ventricle near the foramina of Monro. This hyperdensity reflects the highly proteinaceous and mucinous nature of the colloid cyst contents. No significant enhancement is observed post-contrast administration, though the cyst wall may show thin enhancement.
What is the diagnosis? Explain the origin of these cysts and their clinical presentation.
The diagnosis is a colloid cyst of the third ventricle. These are benign neuroepithelial cysts that classically arise from the inferior aspect of the septum pellucidum. They project directly into the anterosuperior third ventricle, positioned between the columns of the fornix. Clinical symptoms include positional headaches, transient visual blurring, gait disturbances, papilledema, and drop attacks. These symptoms are caused by intermittent ball valve obstruction of CSF flow through the foramina of Monro.
What are the key differential diagnoses for a third ventricular region lesion, and how do you differentiate them?
Differentials include a giant basilar tip aneurysm, meningioma, arachnoid cyst, dermoid cyst, and ependymoma. A basilar tip aneurysm is a critical vascular differential that can mimic a colloid cyst on unenhanced CT. However, it demonstrates flow voids on MRI. Meningiomas show intense uniform contrast enhancement and calcification, whereas arachnoid cysts are isointense to CSF on all sequences. Dermoid cysts contain macroscopic fat, showing low attenuation on CT and mixed signal with fat suppression on MRI.
Discuss the risk of acute deterioration and how you would manage this patient as a radiologist.
Even though colloid cysts are histologically benign, they pose a significant threat of sudden death due to acute obstructive hydrocephalus and brain herniation. As a radiologist, I would carefully assess for secondary signs of elevated intracranial pressure, such as temporal horn dilatation or tonsillar herniation. I would communicate this finding immediately as a critical alert to the referring physician. I would recommend an urgent neurosurgical consultation for cyst excision or endoscopic fenestration to prevent life-threatening CSF flow obstruction.